In 2007, we started the initiative for molecular profiling in advanced cancer therapy. The hypothesis of the study was that that tumor molecular profiling will help us optimize treatment selection based on patients' tumor molecular abnormalities, and therefore we would have superior outcomes compared to the standard approach.
And when it comes to the presentation from today, how much is that borne out to be accurate and true?
The hypothesis was proven to be accurate since from 2007 until 2013, we ordered tumor molecular profiling in 3,743 patients. 13 of those patients, 1,307 patients had at least one molecular alteration, or 35%. And of these 1,307 patients, 711 were treated with match-targeted therapy, and 695 patients were treated with non-match therapy. We treated these patients on clinical trials with investigational agents, first in human or with FDA-approved drugs in new combinations. Patients were heavily pretreated, and they had a median of 4 prior therapies, ranging from 0 to 16. 2.8% of patients were not previously treated. They had rare, incurable tumors. We demonstrate patients had various tumor types, including gastrointestinal tumors, including colorectal, gynecologic tumors, melanoma, breast, and lung cancer. The overall response rate was 19% in patients treated with match-targeted therapy, compared to 5% in those treated with non-match therapy. And when we took into consideration disease stabilization for at least 6 months, the overall tumor response control rate was 35% in the match therapy group compared to 20% in the non-match therapy group. And this was statistically significant. This improved disease control was also associated with longer progression-free survival in the match therapy group. The median progression-free survival was 4 months in the match therapy group compared to 2.8 months in the non-match therapy group, and the hazard ratio was 0.67. The median overall survival was 9.3 months in the match therapy group compared to 7.3 months in the non-match therapy group, and the hazard ratio was 0.72. Then we performed univariate and multivariate analysis, trying to identify, to determine the association between patients' baseline characteristics and survival. We found that patients who had PI3 kinase alterations had inferior outcomes. In multivariate analysis, factors predicting shorter overall survival were PI3 kinase, AKT, mTOR pathway abnormalities, and other characteristics indicating advanced metastatic cancer, such as performance status greater than 1, increased liver LDH levels, liver metastasis, abnormally low albumin levels, a higher platelet count, as well as age 60 years or older. Then we used each of these parameters, pre-treatment characteristics, to develop a score. We gave 1 point to each of these parameters, and we developed a score according to which we can predict patient survival, taking into consideration their baseline characteristics, and this survival ranges from if patients had 0 points, about 15 months, to 2 months if they have, or less than 2 months if they have all 6 to 7 points. Then in the multivariate analysis, we added the type of therapy, and we found that non-match therapy was associated with shorter survival, together with all the other pretreatment characteristics we just described. Therefore, match-targeted therapy was an independent factor associated with longer survival. And therefore, in conclusion, we found that match-targeted therapy is associated with longer survival compared to non-match therapy, It is an independent factor predicting survival. The 3-year survival rate was 15% in patients treated with matched therapy compared to 7% in those patients treated with non-matched therapy. And at 10 years, the 10-year overall survival rate was 6% in the matched targeted therapy group compared to 1% in the non-matched therapy group. Our results demonstrate the value of using personalized medicine in treating patients with advanced cancer. We would like to implement precision medicine, which holds the promise of improving the clinical outcomes of patients with cancer.